Did you know that being a doctor is nothing like the TV show Grey's Anatomy? I know, shocking, isn't it? Also, not quite as shocking, is once you're a doctor, there are heaps of different pathways and specialities you can go down, just like general surgeon. So if you're a patient and you need an operation, a general surgeon is the person, along with a whole team of highly skilled staff, that cuts you open, messes around with your insides, and quite possibly saves your life. Being a general surgeon is not just about the operation. They meet with patients, examine them, determine if they need an operation, and explain risks and procedures. There's also post-operative care, making sure the patient is progressing well and maintaining records. Today, we're chatting with Dr. Chandra to see what it feels like to be able to save someone's life. Dr. Chandra.
Hi, Jesse. Nice to meet you.
Look, I want to find out what it's like to be a general surgeon. Keen for a chat?
Fantastic. Let me show you around.
Beauty. So much equipment. I'm afraid I'll break something.
No fear of that. Jesse, what would you like to know?
Well, first up, what exactly is a general surgeon?
So a general surgeon is a surgeon, and once upon a time we were all general surgeons, but slowly what's happened is we've divided up into different parts of the body, different subspecialties. But true general surgeons are a combination of surgeon who operates, but also physicians who do medical management on the wards, and that's what makes general surgery so challenging.
And why did you choose to be a general surgeon?
I chose general surgery because I get to see people on the worst day of their lives, and hopefully we can actually change that. We can actually remove tumours, we can fix emergency situations, we can actually make people better very, very quickly, which is incredibly rewarding.
And you mentioned the emergency department and that sort of thing. What is the most challenging part of the job?
Look, it gets very scary because you can see people who are very sick and they're very unstable to operate on. You know, you could be working around very large blood vessels where, you know, a millimetre error in either direction and that could be the end. And things don't always go according to plan. Some people get complications, you have people that have issues, people that don't do as well after surgery as you would like, and that can be really quite challenging.
Wow. Now, I can see there's heaps of equipment around us. Can you take me through just a typical day?
So a typical day would start with a ward round where we do a round and check all of the inpatients and make sure that they're doing well. Then we'll usually go to my clinic and I'll see patients that have had surgery or needing to have surgery. We'll often have surgery in the afternoon and often end with emergencies towards the end of the day.
Sounds like a pretty intense day.
It can get crazy.
Well, Dr. Chandra, I think now it's time for the end. You ready?
We're ready.
Okay, so first one, what characteristics does someone need to be a general surgeon?
So they need to be technically quite good with their hands. They need to be able to actually physically get things done. But more than that is they need to be good at decision making. They need to be able to talk to people. They need to be able to listen to what they have to say. So those parts of the job are probably harder than the actual surgery itself. Is really just chatting to people and making sure that they know what's going to happen.
Now, could you list from school to today, what does someone need to do to get to where you are?
These days you don't have to do any particular subject at school, so you can choose whatever you want to do. And then you have to do an undergraduate degree, and that can be anything you like. Then you have to sit an exam called the GAMSAT, which is a general aptitude test, and then you have an interview, and then hopefully one of the medical faculties will accept you. 4 to 5 years of medicine, and then you become a junior doctor, 5 years of training, a nasty exam at the end of that, and then you become a surgeon.
And then you get the white coat and the stethoscope.
Pretty much.
Okay, so lastly, if you could give one piece of advice to someone thinking about moving into medicine or general surgeon, what would that be?
I think it would be to just talk to people early. So if you've got that idea that you want to be a surgeon, general, orthopaedic, whatever, come along and talk to one of us and we're more than happy to spend some time.
Awesome, thanks so much for the chat, Dr. Chandra.
Not a problem.
Do you have any sort of, anything I can wear maybe?
Absolutely, come with me and we'll make that happen for you. Cheers.
Awesome,
All right,
let's do it.
This way.
Okay, here we go. This is happening. This is, no, hold back. Authorised by the Government of Western Australia, Perth.